Hello, I'm Dr. Fox. Today, I'd like to talk about amniocentesis. Okay, so first of all, what is carrier screening? Carrier screening means having your blood or saliva checked before you become pregnant or during early pregnancy to see if you are a carrier of certain genetic conditions that could affect your baby. These include cystic fibrosis, Fragile X syndrome, sickle cell disease, thalassemia, and heart defect. If you are a carrier, it means you don't have the condition yourself, but you can pass it to your baby. If you and your partner are both carriers of the same condition, there is a higher risk that your baby will have it. Okay then, what is an amniocentesis? On the other hand, amniocentesis is a diagnostic test. This means that it tells you for sure whether or not your baby has a health condition. This is different from a screening test that tells if your baby is more likely than others to have a certain condition. If results of screening tests aren't normal, you may want to have a diagnostic test like amniocentesis to diagnose if your baby has a condition. An amniocentesis is normally carried out during the second trimester of pregnancy and sometimes during the third. It checks for certain types of birth defect, medical conditions present at the time of birth which change the shape or function of a part of the body. Often they cause health problems or mean the child cannot develop normally. A doctor takes a sample of the amniotic fluid, which is the liquid which surrounds your unborn baby in your womb. This contains genetic information which is then analyzed in a laboratory. Okay then, what medical conditions are shown by an amniocentesis? An amniocentesis carried out in the second trimester usually detects chromosome abnormalities such as Down syndrome, birth defects of the brain and spine called neural tube defects, or NTDs such as minor bifida, and anencephaly, and inherited metabolic disorders like phenylketonuria. So, who should have an amniocentesis? Women in their second or third trimesters are advised to have an amniocentesis if doctors think there are risks of birth defects. Women are not normally advised to have an amniocentesis before 15 weeks because there is a higher risk of miscarriage and other complications. Doctors often advise certain groups of women to have amniocentesis as they are at increased risks. One group is women aged 35 or older. As the older you are, the greater the risk of having a baby with a chromosomal condition. Chromosomes are the structures in cells which hold genes. Another group is mothers who already have a child or children with a birth defect or a previous pregnancy with a birth defect. You may also be advised to have an amniocentesis if there is any family history of genetic conditions on your or your partner's side. If you have already had a different screening test and the results are abnormal, doctors may want to carry out an amniocentesis to get more information on possible problems. Some women are advised to have an amniocentesis during their third trimester to check for lung development, infection, and HR incompatibility, which means that you and your baby have different blood types, as this can cause severe amnio in the unborn baby. The test can tell doctors whether your baby's lungs are strong enough for her to breathe properly when she is born, so they can decide, for example, whether to delay delivering the baby even if your waters break, to give her time for her lungs to grow. Delayed amniocentesis is also used to treat a condition called polyhydramnios, which means having too much amniotic fluid, as this can cause premature birth. In this case, the amniocentesis needle is used to drain the extra fluid from the womb. Okay then, What happens during amniocentesis? The doctor uses an ultrasound to guide a long thin needle through your abdomen into the amniotic sac to gather a small amount of amniotic fluid. The procedure usually takes about 10 minutes. You may have a cramping feeling, like period pain when the needle goes in or while the doctor is taking a sample, and it is recommended that you rest for a few hours after the test is finished. Don't take exercise and don't take sex for a couple of days. The fluid sample is then sent to the laboratory for analysis, and the results are usually available within a few weeks. Okay, next. What are the advantages and disadvantages to having amniocentesis? Amniocentesis is extremely accurate. In fact, it has an almost 100% accuracy rate, but it cannot detect all possible disorders. For example, it can't detect certain heart problems or a cleft lip. As concerns risks, it can cause miscarriage. Between 1 in 300 and 1 in 500 women who have amniocentesis miscarry the baby as a consequence. There is also a small risk that it will cause an infection in your uterus, which can also lead to miscarriage or injury to the fetus. A very few women, about 1 to 2%, experience cramping, spotting, leaking amniotic fluid. If you have a different blood type to your baby, there is a small possibility your blood will mix, which could hurt the baby. In this case, you may be given an Rh immunoglobulin shot after the amniocentesis to make sure this does not happen. Okay, so finally, is there anything you should look out for after an amniocentesis? Call your doctor if you have had an amniocentesis and you think your baby is moving differently or have stopped moving. If there is redness or swelling where the needle went in, if you are running a temperature, if you have strong belly cramps for several hours, or if there is blood or fluid coming out of your vagina. Okay, thank you for watching. See you soon.